Hey, aloha, love tribe. Happy holidays. Woohoo. 2 more days till the Santa Claus man jumps down the chimney and brings lots of joy and generosity to all the little kids all over the world. But somebody I have here who is a super generous Santa gave a little girl a prosthetic arm, a miracle for Christmas. And I am so impressed and inspired by Andy Schoonover, who is the CEO of Crowd Health. Welcome, Andy.
Thanks for having me. Merry Christmas.
Yeah, Merry Christmas. So I saw your post and, first I'll let you talk about, who you are and how you got to Crowd Health, but I also want to just kind of name what happened. And I mean, this is so inspiring to me because not only, did this little girl get a Christmas miracle, it's like she wasn't even a client of yours. And that's what made it so special. You just saw this on, I believe it was Mario Narfal's
hmm
thing. And then you were just like, heck yeah, we got this. So could you share a little bit about that experience? Like talk about what happened with this young girl. And then obviously talk about, crowd health and what your business is and how you got here. There's going to be a whole bunch. So we'll dissect
Yeah.
it. But I'm so you just warmed my heart. It's just so great. So thank you for being you, Andy. And yeah,
Yeah. Well, thank
welcome.
you. Thank you again. So I feel very much like divine intervention is one of those things where you scroll through X, you never
Yeah.
really are sure what the algorithm is going to give you that day.
Yeah.
And Mario's story popped up, and I think he linked it back to a Daily Mail or something uh, article about this little girl in Utah who needed a prosthetic arm, but her health insurance plan declined to give it to her. Um, and so I'm just like, man, that is so crazy to me that a health plan would deny, this little 9-year old who's cute as can be.
Yeah.
She was wearing a shirt that said she actually lost her arm after or during kind of the birthing process.
Oh,
I think the
wow.
umbilical cord got wrapped around her arm and it cut off the circulation, and so
Oh my
she
gosh.
lost her arm. And she was sitting there and she had this shirt on that says, "Before you ask, it was a shark." Um, and it just it like it it's this cute blonde girl with glasses. I was like, man, like that's awful. Like I'd love to help her. And so
Right here, this shirt right here.
let's see, is that the
Hold on.
one?
Is that before you ask it was a shark?
Yeah, I think the one on the right is what the one that
Yeah.
says it. Yeah.
Right here. Oh my
Um,
god.
and so I kind of, through the crowd health handle was like, hey, if anybody knows this mom, like let me reach out to her. I'd love to reach out to her and help. And so ultimately I went to the GoFundMe and I clicked on the link to GoFundMe, which I think emailed her mom. Her mom reached out to me. I had a conversation with her and I was just like, man, I just feel compelled to help you. So I would love to, buy your daughter's prosthetic arm, which is about $25,000.
Wow.
And she was just overwhelmed with, joy, of course, from that. And she said, but I have a GoFundMe account going on and it's doing really, really well. And I said, well, why don't you just use that for educational purposes? Like, Remy is 9, and she's got, some educational costs coming up. Just use it for that. And she's like, okay, well, I'll do that. And then the beautiful thing about this is that her mom emailed me the next day and said Remy has enough for another prosthetic arm. And so instead of her using it for educational purposes, she found another girl who was declined a prosthetic arm. And so Remy is going to buy this other little girl, or excuse me, this other little boy, his name is Taj, a
Gosh.
prosthetic arm. And I'm like, what? Like, how cool is that? And she got so much publicity that she's now trying to fund her third prosthetic arm, this one for another little girl named Faith. And
Yay.
so I'm like, Remy is the generous one here. She could have easily pocketed that money and used it for her educational. Instead, she just wanted to like continue to give, and I think the beauty of that story, especially as we approach Christmas time, is just really, really cool that this little girl had such a big heart. She got screwed by the system, but instead of acting in, retaliation or acting in kind of the sense of entitlement, she reacted in the sense of generosity. And so I just thought that was so, so cool. And so Remy's going to get her arm here soon. I'm going to fly up to. She's actually getting her arm in Colorado. She lives in Utah, but she's getting her arm in Colorado. I'm going to fly up to Colorado and meet her and just kind of the family was willing to allow me to share that experience of Remy getting her arm. So it'll be a really cool thing.
Oh my god, that's so cool. Well, come say hi to us at the Denver Space, which if you're in town, like, and just, pop in if you have time. But this is so, like, what a blessing, right? Like, we learn by people's examples, right? And so I think that, like, this young girl obviously got the love from you and the care from you, and she's just like, yeah, I want to pay it forward, and like, what a great example for all of us to remember, like, the way that life flows and how energy flows and the divine flows through everything. And it's like, if we can go and operate from a place of feeling abundant and generous and prosperous, it's like it frees up those blocks, right? And so it keeps the thing circulating. And I think as Bitcoiners, we love that because we think of, the global circular economy as Bitcoiners. So it's
Hmm.
like, wow, how can we zap each other and, send money? We just raised almost 500,000 sats for, I called it sats for tots. And we're donating a bunch of Shamory. It's not $25,000, but it's toys from Shamory, for some kids at Toys for Tots.
Awesome.
So it's just been so nice to see the Bitcoiners, zapping 10 sats or zapping 50,000 sats or whatever. And it's like, it's such a nice feeling to know that, like, yeah, the world is an abundant place. And so let's talk about you, Andy, and, your backstory with, starting Crowd Health. How did you become the CEO of this very unique company? And we'll talk about what is Crowd Health, obviously, for people to understand.
Sure. I mean, I think that the segue from Remy to Crowd Health here is a pretty clear one. And one of the things I'm thinking about Remy is that her misery birthed her mission.
Yeah.
She had a really hard. I mean, she had a rough start in life. She's got to do with one arm what other people would do with two arms. Her misery is now creating a mission to help all these other little kids who are also in the same situation as her.
Yeah.
From my and I see that over and over and over again playing out. My wife and I lost our first daughter right after she was born
Oh,
due to a congenital condition, and
so
that
sorry.
misery, which is real, very, very real,
Yeah.
has created a mission for us to help other families who also are in that situation. And to a much less extent, I was on health insurance before, and I was in the same situation as Remy, but in this case, my daughter, who was having recurring ear infections, was denied the ear tubes, tubes in her ears. In
Yeah.
essence, what
Yeah.
happens is that you get so much built up within your
Yep.
ears because of these infections. It bursts your eardrum, and then it just is impossible to get that to heal without putting a little tube in there, so all the stuff can drain out, so you don't have any
Hmm.
pressure on your eardrums.
Yeah,
So
totally.
parents out there who got kids that cry, I mean, crying night and day, all day long. I mean, it was an absolute painful experience that got resolved with these ear tubes. But
Wow.
the insurance plan denied them for my daughter, saying that it was medically unnecessary. So the exact same reason that Remy got denied by hers, medically unnecessary, is kind of the overarching term that the health insurance plans use to say we're not paying for that. and I knew it worked because my daughter stopped crying. She was totally fine. She slept better. She, didn't lead this miserable existence that she had previously, and so we're just so thankful for that. But I called the health insurance plan, and after two appeals, they just said no, we're not paying for it, and said fine. You're not going to pay my bills, I'm not going to pay your bills, and so my wife and two daughters went uninsured. And over
Wow.
a period of time, we just try to figure out, like, how do we viably pay healthcare bills without having health insurance, and actually found it really, really easy, much easier than going through health insurance. And that kind of all culminated in me founding Crowd Health, because I was like, I bet you other people hate health insurance as much as I do and want the tools and the tricks to beat this system. And so, we started Crowd Health in 2021, and here we are, almost 4 years later. So it's been a very, very fun ride.
Well, and I think, what you were mentioning earlier, obviously, about this young girl and, your child, and it's really frustrating when you've got admin and bureaucratic people who are not doctors who are saying what's medically necessary and what's not. And so, you know, we all, we spoke before we went live, and, you know, why is a stack of prescriptions medically necessary for people with mental health issues or depression or anxiety or
Hmm.
whatnot, or pain? Obviously, people get addicted to these painkillers. Um, and so that just keeps the machine running, right? And so it's very, very challenging to think like, why do they get to say what's medically necessary? And especially this child, and obviously your child with, I know what it's like to have kids up all night screaming with ear infections, and if it's consistent and you really do need those tubes, which are very important, um, that's impacting the mental and emotional health of the whole family, and obviously the child. And so, obviously we understand physical, necessity for things. And then when you don't have that, it can lead to these long-term, chronic mental health issues. Right. And so it's very, very challenging. I think this system is so broken and so funded by, big pharma to keep their
Hmm.
script pads chunky and fat. And so, this is just such a great gift that you've given this beautiful child. And then this is the other child. This is Taj,
Gosh.
right? Yeah.
Yeah.
And so, um, I just think it's just such a cool thing. And so let's talk about, so how does crowd health work, and how do people get this? Because I know we talked a little, and I've got some friends who are, looking to sign up, and, you know, I know a lot of people have, why don't you explain how it works first, and then we'll bring up some of the other points and go from there.
Sure. Yeah, man, I think like the key moment that I finally said this could be a business is that when I started, appealing this what ended up being an $8,000 bill that my daughter had, and I had to stroke an $8,000 check to the local hospital, and
Wow.
I put something up on X describing this experience, and I had a bunch of doctors reach out to me, and one of them was like, "Oh yeah, we do these in our office all day long, and it's like $1,500." And I'm like, wait, hold on a second. Like, I just paid $8,000 to a hospital to do this, and you could do these for $1,500. They're like, "Oh yeah,
Wow.
yeah. If you pay in cash, then we can do these for 1,500 bucks because it's only a 15-minute procedure. So it's not like this like super intense, cutting and opening and all that kind of stuff. It's super super easy. And so the light flicked on to me is like, if I can enable people to pay in cash for all of their procedures, whether it be small ones or big ones, then we could significantly reduce the price of healthcare. And if you can significantly reduce the price of healthcare, then you can, you don't have to do all of these, denials and things like that to make the numbers work, right? If we cut the healthcare costs in half, then you have a lot of room there to do things that people really want to do with their healthcare. And so that's when the light really flicked on to me. And so in essence, what we're doing with Crowd Health is we've got this platform where we've got 10,000 people on it, so that if somebody in our community gets hurt, has an illness, gets pregnant, whatever it may be, they can submit that bill to the community. And then a certain number of people will be asked to help that person. So let's say, for example, Remy, needs her prosthetic. I'm just going to use the $20,000 number just to make the math easy.
Hmm.
So she's got a $20,000 prosthetic, which, by the way, is significantly less than what it would cost if she paid with health insurance. So she's already getting a cash pay discount.
Hmm.
So I'm going to go to, let's just say 200 people in the community and ask them for $100 to help out Remy with her prosthetic arm. And so I'll ask the first person, and they'll say yes, and that means that $100 will go from that person to Remy. And at the end of the day, when I have 200 people who said yes, Remy has her $20,000 so that she can now go pay for her prosthetic directly. So, that's the way it works. And the cool part about that is like, exactly where your money is going. right? If
Right.
if I ask you to help Remy, your money is going directly to Remy to help with her prosthetic. Crowd Health does not get in the middle of that. It literally goes from your account to Remy's account. And so that's the really cool part of this. And people actually like are treated like humans again, as opposed to just numbers in a spreadsheet. We've had multiple occasions in which people had miscarriages, and there were costs associated with that. And so we reached out to the community, and we got feedback from the community that was like, man, I know what this feels like. Like, my family has gone through this, especially the women. They're like,
Yeah.
I know the pain that this woman is going through right now. Can I give, instead of $100, can I give $200?
Wow.
Like, never in a million years would you call United Healthcare and be like, hey, United Healthcare, can I pay you more this month? No, but this is a transaction between human beings,
Yeah.
which there's just another kind of whole like human component to that is, I mean, I love sending my bill or my money to somebody else in the community, because it feels good to me. I'm helping somebody else out directly. And so that's how it works. I'm happy to go into the mechanics of how it works specifically, but ultimately what we're doing is connecting human beings so they can help each other when they're most in need. Over 20,000 bills, it's worked 99.8% of the time. So it's been
Wow.
super effective in getting these bills paid.
And so, because when I was in Austin last week, several of us were talking about, this program and like, how would it work? How would it work if you're out of the country, for example? Like, let's say I go to El Salvador, I'm at adopting Bitcoin, and I hurt my foot, God forbid, whatever. Um, how does it work if you're out of the country? Is it just for in country in the
No,
state?
out of the country too. And in fact, we had a guy maybe even 3 or 4 months ago, maybe, yeah, ish. He went to Japan. He got bacterial meningitis while he was there.
Whoa.
He was in a coma for 3 or 4 days.
Whoa.
And he had travel insurance, but his travel insurance denied it. And so he submitted to Crowd Health. Crowd Health got it paid for. I think we funded that within like 3 days.
Oh my God.
Um, and so we say, like, don't get travel insurance. It's a bunch of garbage from my perspective. If you're a Crowd Health member, wherever you are in the world, you can use it. So there's no longer any need to do these garbage travel insurance plans.
Wow. What about, okay, so that's incredible because obviously a lot of, Bitcoiners, we're traveling, we do conferences, we're,
Yeah.
nomads, etc. I think that's super important. So how, just, because mentally I'm just envisioning a group of 10,000 people, right, who are in this community. Is there a way that you're sort of tracking, um, because you said, oh, I would ask, say 200 people for $100 or whatever it was.
Uh-huh.
How does your system know which 200 people to ask? Is it looking at sort of like, okay, here's our pool of 10,000, these 9,800 people have already given a whole, they've kind of are equally what they've given. Do we ask the next 200 just so that people are kind of getting up to the same level of giving? Or I'm just curious, like what's
Yeah,
the
it's a
math
great
on that?
question. Yes, we only ask you once a month in a round robin style
Got it.
approach. So the person who has the oldest request starts first, and then we ask those first 200 people. And if five say no, we'll ask the next five people who are the oldest. And so it's a round robin, but only once per month will we ask. So that's how that works.
Got it. So it's not like it's not like a geyser page or something where you have a whole bunch of different people's bills and people can just go, cool, I want to help the woman who had the miscarriage and I want to help the runner who sprained his hamstring or something.
Yeah, I mean, we don't have that currently. We ask you for one specific event in which you
Okay.
can say yes to or say no to. I would love for us to be able to go in and say, I want to give to this, and this. It's just we can't like get that done quickly because a lot of times like these people need money quickly,
Right.
and so like how do you do that? But the other thing that people ask when I kind of tell them about this structure, is like, why would I give to Remy, right, when I don't even know who she is? Maybe that one is an easy one because it pulls at your heartstrings a little bit. But what if somebody, breaks their ankle, playing basketball? Like, not really a heartstring tugger. But one of the things that happens is when that person submits a bill to the community. What we know about that person is how generous have they been to the community over the last 10 times that they've been asked.
Okay.
So have they said yes, 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 or have they said no, 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 right? And so if they've said yes, 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 they've been a great member of the community. Whenever they've been asked, they've been willing to help. If they've said no, 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 then they're probably takers from the community and not givers from the community.
Okay.
And so when I said earlier that 99.8% of these bills have gotten funded, the 0.2% that haven't gotten funded are from the people who have been takers and not givers. Meaning that when the community sees that you're not being a good member of the community, those bills are not generally getting funded fully. And so that's how that works. And
How
so
does the community
it's
see that? This sounds like a social credit score type thing.
not a social credit, more like a reputational score. I mean,
Okay.
more like if you're going to eBay or whatever, and you're buying something off of eBay or Amazon or whatever, you're not going to buy something from a one-starred seller. You want a five-starred seller because everybody else in the community has had a really good interaction with them. So
But so there's a
um,
public way to like star people after they've contributed to your bills or something, or how does that work so that you know what those five, let's say 5 stars example.
yeah, so if you we measure it on a kind of 100-point scale.
Okay.
So if you give 9 out of every 10 times, you're a 90 generosity score.
Okay,
If you
cool.
fall below a 90, then we actually make it red. So you see that bill, but it's red, meaning like, hey, you need to make sure you're looking at this person's generosity score before you act upon it. And
Okay.
so and you do not get dinged if you say no to somebody else who has a generosity score that is red.
Oh,
So that's kind
interesting.
of a key component. So that's how that works, and it just creates some reciprocity within the community, and
Cool.
it's worked incredibly well at being the engine that drives this.
And so from a, obviously, so I'm on the site right now and, if we were to look at, let's say pricing, right? So let's go say I'm going to sign up myself. Uh, I will be 55 this year. Okay. So my contributions would be 335 a month ish.
Hmm.
Yeah.
So you'll get billed twice. The
Okay.
first one is for that $55.
Okay.
And that's going to crowd health. So that's the only revenue that we get. It's for us to pay the bills.
Just the
Um,
admin, to keep the lights on, all the good stuff.
exactly. And
Right.
the reason why we made it a membership uh, fee, we call it the advocacy fee, is
Okay.
because now you and I are aligned in terms of what want the outcomes to be. We are fighting hard for you to get these bills paid. Whereas with the health insurance plans, their profit is the difference between how much they bring in and how much they send out,
Right.
right? So they have an incentive to bring in more and send out less. For us, ours is just we want more people in the community, so we have an aligned incentive. We have more people in the community, then if you have a really big bill, there's more people we can ask. Those incentives are totally aligned.
Okay.
So that was the reason why we did that. Then I'm going to charge you, or the second time during the month, another up to $280, and that's going to go directly to another person in the community. And so that is going to Andy because he broke his ankle, or having a baby, or whatever it ends up being. And so that's when I will ask you. And if you say yes, then 280 will go from whatever payment account that you set up when you started to an account that is owned by the person who is the requester, or the people who need help. And then, I think, like I said, at the end of the day, then they have enough money to then go pay for their procedure.
Okay. So I just want to clarify. So each month, Crowd Health would receive 55 to just do all the hard work that you're doing, negotiating and keeping the,
Hmm.
admin and tech running. And then the other 280 is something that's going to get used for those bills that are going to kind of go around to each of the members. And you'll say, yes, I want to pay for Andy's ankle thing.
Exactly.
Got it. And you say
Exactly.
up to 280 or is it always 280?
Yeah, it's up to 280. And so in fact this month I think we only asked for 220 of the 280 because our bills are so low that we don't need all 280. So you get to keep that remaining 60. You can do with it whatever you want. Buy Bitcoin with that $60. Buy a good ribeye, whatever you want to do with it. We're never going to ask for it back. That's your money. You hold it. In the insurance model, if you have really low bills, the insurance company keeps it. In our model, you keep it, which incentivizes the entire community to do really well with these bills because you're feeling it directly, which is kind of a cool different thing than the way health insurance work or some of these other health shares work.
Wow. And so what I'm hearing, just because my mind's still in the old, medical
Yeah,
matrix of, $7,000 deductible, all the copays and co-insurance, la da da. Um, how does it? So this is like, would I pay extra? Like if let's say I do, I'm in an injury and like this doesn't cover it, I'm still going to have another couple $1,000 bill, or does that go back into the community also? And so ideally, is it each month you're not coming out of pocket more than the max 335 if if you're my age, or are you having all these other possible bills that are going to get on top of this?
right. That's a great question. So one of the things that I wanted to do as I started researching just the matrix, as you called it, early on was I found that like 200, somewhere between 200 and 250,000 people, or excuse me, families every year go bankrupt due to a medical expense,
That
even
happened to
though
my
they have
family.
health insurance.
Yeah, my
Yeah.
parents, that happened to them. My mom, stepmom and dad. So
Yeah.
that was
It's crazy.
unbelievable.
These people have health insurance. They get into medical debt because of two reasons. One is denied bills, which I already talked about. The
Mhm.
second is these huge deductibles.
Yep.
So oftentimes, like the healthcare.gov plans, I looked at a healthcare.gov plan for me, my wife, and my two family this year just because I was curious. And it was like, I think it was 16 or no, it was $17,000 deductible.
Oh my
And it was a
god.
$1,300 a month. So basically, I have to pay $30,000 before the health plan pays a dollar. I mean, that's what's silly to me, right?
Wow.
So I'm getting to the answer to your question, but in essence, what I wanted to do was make that any payment for a big illness or injury or pregnancy or whatever it may be is really small so that it doesn't put people into bankruptcy or financial distress. So what we do is we ask you to pay the first $500 of any health event.
Okay.
So if you break your arm and go to the ER, you just pay $500 of that. And so if
Okay.
you break your arm, you go to the ER, you're going to get, x-rays, you're going to get a cast, you're going to get an ER visit. Then you're going to probably have to go to an orthopedist and get more x-rays. And then you probably have to put on a new cast. This may be 5 or 10 doctor visits, a bunch of imaging, an ER visit, maybe even medications if you have to do, a surgery. That's all one health event. So all I'm doing is asking you to pay the first $500 of that. The remainder will be sent to the community. And so we asked for the first 500 so you have some skin in the game.
Yeah.
But there's no huge annual deductibles or anything like that. We just asked you to pay the first $500 of any health event. The rest will submit to the community.
And then what about, like, chronic things? Like, I have thyroid stuff that I'm on, and so whatever, that's just part of, like, a prescription that I do every month, and so
Yeah,
how would that work if somebody has some kind of, chronic issue, or, dialysis or something, that's like they need to
sure.
do repetitively?
Yeah, so we had an issue when people first signed up of something that folks had, and then they would like one of them was like a hip replacement. So somebody jumped in, got their hip funded, and then jumped back out again. And I was
Yeah,
like, wait a second, like this just doesn't work,
that's not
right?
cool.
And so, in essence, what we ask people to do is own their own health events for the first 2 years, and
Okay.
then the third year, the community will start helping out. But I would say for the vast majority of these chronic conditions, I mean, you have some. You just mentioned thyroid. My sister joined, and she's got high blood pressure and thyroid, and so she's taking some meds with that. And she was really worried about like, okay, these meds are going to be really, really expensive. And I was like, look, the vast majority of these things are really inexpensive. My guess is your thyroid medication. Do you know how much you pay for it every month?
It's like $40 a month. I mean, it's not much. It's,
Yeah, and I bet you if you paid in cash with through some of the kind of contacts that we have, it's probably under 20.
so that's
Um,
something that, so for people who would sign up, they could have like your resource guide of kind of go
oh yeah,
here, get your scripts, get your stuff, get your lab work, whatever,
yep,
and then do things that are at more cash basis type stuff.
exactly.
Um, that's
We
super
are our
cool.
superpower is finding like awesome, docs and services at really low prices.
What
I
about
usually I
oh,
do
sorry, go ahead.
labs twice a year,
Okay.
and I want like the full set, and so I went and tried to find it by myself, and it was $1,000. And I went and Crowd Health found it for me for I think it was like $85.
Oh, wow. And is this like full panels like a functional medicine doctor would do, or
I mean,
regular?
it was pretty full. I mean, it's probably not all the things that the functional would do, but I mean, it's good enough for me. I mean, it was I think probably 60 or 70 different tests for, under $100.
Wow, that's incredible. So, okay, so then just circling back. So clarifying, so for the first 2 years, if you have any claims or anything, you're taking it out of pocket yourself?
Only for pre-existing.
Only for
So
pre-existing. So if you've got
if
a
you sign up today and you find out you have cancer tomorrow, that is fully eligible.
okay,
If you
got
signed up
it.
today and you found out you had cancer 3 days ago, that's not eligible.
Got it.
So
Okay.
anything that happens while you're a member is fully eligible. But anything beforehand, and we only look back like 5 years. And so
Okay.
if you had cancer 10 years ago, and it pops back up the day after you join, that's still eligible because we only look back 5 years.
Okay, so it's a 5-year look back for pre-existing conditions. And then so if you have again, I'm just clarifying for people who are
Yeah,
listening,
sure.
and so if you have a pre-existing condition, it'll have a look back of 5 years, and then in 2 years you'll start, because you're obviously been participating in the community and whatnot for 2 years, then Crowd Health will start offering the ability for you to submit a claim, or
Yeah,
yeah,
you got it.
okay. Got it. Cool. What about uh is so 2 things I think of, you're like, "Oh, if you don't get if it's 220 versus 280 this month, go buy some Bitcoin." What are there any, uh, HSA things where we could go put Bitcoin into an HSA and use those funds to pay for these things, and then have a tax incentive? Like, I think we're at 3,000 3 something a year, or
I think it's
2,700, I forget.
4,000 now. I
4,000,
think it's
okay, it keeps going up.
4,100 max you can put in an HSA. And unfortunately, the the big health insurance plans have been incredible at lobbying so that you have to have a health insurance plan to have an HSA
Got it. So
or
this won't
to submit more to an HSA.
okay.
What we're doing is, in that $60 that you saved, if you're a part of our what we call our Bitcoin crowd, we will automatically sweep that $60 into a Fold account, which then converts that to Bitcoin. So you're basically having your own Bitcoin health savings account that you're contributing to every month with kind of the excess funds that are not being used. So that's pretty cool. So and we will pay your Fold Plus fees as well as a part of that. So people who are familiar with Fold, it's usually $100 a month, or excuse me, $100 a year to
Okay.
pay for that. We'll pick up that cost, and then any excess dollars will be flow into Fold. And I think that's more valuable than any deduction or whatever you get through HSAs. So that's how we do it now. I'm hoping with the current administration, or the new administration, excuse me, the HSAs and the health plans will be kind of bifurcated, so you can submit to an HSA without having to have a high deductible health plan.
Yeah, it seems like, I mean, obviously the insurance lobby is not gonna be so excited about that, as you mentioned, but it's like, it seems like every citizen should have a larger ability to have a separate account to save for their medical expenses that are, tax free, and they can grow
Yeah,
tax free, obviously. And so that seems like something that could also ease some of the burden of the costs of the medical system that's put on the government right now. I mean, who knows? But, um, I don't know, just I'm so excited to see, like, I love what you're doing because, we look at all these different, we just had the independent music summit and the Boostagram thing. So it's like, here's a segment of artists and creatives and podcasters and authors and
Yeah.
musicians and DJs who are using Bitcoin this way to grow their audience base. And you're using Bitcoin to help with healthcare, and get people, the ability to not go bankrupt, hopefully, because of these outrageous things that they have to deal with. I know this happened over 20 years ago. Gosh, about, more than that with my folks. And, I wasn't in a position where I could bail them out, that back then. And it was just devastating because my bonus mom was diabetic and, her diabetes medicine was like more than they made, and they were
Mm.
retired. So it was just this awful, um, she just couldn't afford to pay, and so they lost so many things in their life. And I'm like, she wasn't the healthiest woman, so obviously it's what she was consuming wasn't helpful, but it just doesn't seem like you should go bankrupt because of an illness or an accident,
Hmm.
like that's just so sad.
100%.
Yeah. Um, so yeah, this is exciting, Andy. I really like, so tell me, like, what have been some of the, you said the story about the woman with the miscarriage, and how did, what are some interesting stories too that maybe you can share, uh, for some folks?
Yeah, I mean, I think one of my biggest learnings are, when you go into starting a company, you have these set of assumptions, and if these assumptions work out, then I think we've really got something here that can change the trajectory of healthcare. And one of my big, hypotheses was that if I can pay our doctors in cash, then that's going to change the game. Because in essence, not to get too deep into like the healthcare mechanics, but doctors spend like 2 days a week fighting with health insurance plans.
Oh my gosh.
Like they're not taking care of patients; they're fighting with health insurance plans. I was like, what would happen to our system if doctors could focus those 2 days on actually doing what they're gifted with doing? You
Yeah.
know, and because of that, they have to fit so many people in their daily kind of schedule just to make money that they can't go like deep enough to understand like what the problems, the root causes are of some of these conditions. And so the system, just the way that it's set up through health insurance, almost forces doctors to take this symptom relieving approach as opposed to an illness, relieving, or a root cause approach. And that's why I think we have so many people on pharmaceuticals and all these things, because somebody comes in with a symptom, the doctor's like, I know how to resolve that symptom. I don't really have enough time to treat everything, but here's a medication. And so we have all these people on 5, 6, 7 medications, and
Mhm.
it's a sad state of affairs. From my perspective, all created because the health insurance plan is the payer and not the patient, right?
Yeah.
And so the healthcare system is between the payers and the hospital systems or the doctors, and so it's a business to business transaction, and the patient is not even a part of that transaction, and so therefore you're not actually the customer, you're the product,
Mm.
right? These
Yeah.
big organizations are using you and your illness to create wealth.
Yeah, to create
They're
billing.
to
And
create billing.
oh my gosh.
And that's the craziness of our system is you're not even a part of it. You're the patient, you should be the center of it, and in fact you're not even a party to the contract. And that therefore means that the doctor that you're seeing, I always say that like the you work for whoever pays you. The
Yeah.
doctor is getting paid by the health insurance plan ultimately, and so the doctor works for the health insurance plan. The doctor doesn't work for you. But if I can go in there and I can actually pay in cash the doctor directly, guess what? The doctor now works for me, and I
Yeah.
can fire the doctor. Where that's the beauty of this system is you want to rip out the government, the health insurance plans, your company that you're working for out from the middle of that relationship, so that the patient doctor relationship can get back to where it needs to be. So that was the biggest revelation for me kind of going through this is if you pay in
Yeah.
cash directly, you make the doctor's life better. he can spend a lot more time. He or she can spend a lot more time with you, and you're actually the customer now, as opposed to the health insurance plan that, under that system, the doctor has to satisfy them, not you. That was one of the biggest revelations for me.
That's amazing. I think about, and you make such a good point because of the doctors and all the interesting disconnections that we have, and we have to, like when this little girl, Remy, her doctor said, yes, it's medically necessary for her to have an arm. And because it was through this, awful insurance company that said no, it wasn't the doctor patient relationship that was driving this girl's healthcare, which is obviously a lot of the issues that we have to navigate. And so, what have you have you encountered, because obviously we think about high and low time preferences, Bitcoiners, right? And we
Yeah.
think about, the doctors get in, get out. We've got 11 minutes to see you. What's wrong? Okay, da 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 da. Here's a symptom. Here's a script. Let's go, go, go. Next, next, next. Cattle, cattle, cattle. So you don't get to have a more of a holistic, intimate relationship with your doctor. You really do. I mean, I've never felt treated like me as a human, as a whole human, by any doctors in this medical system. And I have friends who are doctors, and they know, they're just like you
Hmm.
said, they spend so much time doing the nonsense instead of really being able to spend that extra time with their patients to understand, like, I don't know about you, Andy, but anytime I've gone to a Western medical doctor, I don't get asked how much sunshine am I getting. I don't get asked, what am I consuming mentally, like my social media or my content. I don't get asked all the questions that definitely, how much are you sleeping? Who are you having fun? And so, like, those to me are such baseline questions for all of us to know, like, hey, go outside for another 20 minutes a day and get some sunshine on your skin and eyes. That's good for you. Um, it's so sad because they're just funded and incentivized
Hmm.
with the prescriptions, and have you ran into, or are you starting to see a trend with any of the doctors and the providers that are like, yay, crowd health is awesome. We want more patients like this so that we can not deal with the insurance companies.
Absolutely. And in fact, I've said a couple times, I think the best doctors in the world will not accept health insurance in the next
Mm,
decade. I think they are so fed up with this
yeah.
that they're like, we want to get rid of health insurance. Crowd Health, if you have members who are willing to pay in cash, please send them our way because we want these patients. Um, because I want to start, if United Healthcare is 70% of my revenue, I can't just say no to them day one. But if I can turn that into 60 and then 50 and then 40, I can wean myself off of health insurance. And that's really
Hmm.
what we're enabling these doctors to do. So we have doctors, like dozens every week, reaching out to us saying, hey, please send members my way because I want to get off this, rat race of health insurance. And it's a beautiful thing, and I think the consumerization of healthcare is going to be real over the next 5 to 10 years for sure.
And do you like, what's your growth rate right now with crowd health? Like, are you getting a good, are you getting your up and to the left, up to the right? Sorry. I'm
Yeah,
dyslexic right
no, it's
now.
it's all right. Yeah, no, we grew about 150% last year. We'll probably grow 100 and 40 or 50% this year. So we've got about 10,000 customers currently on the platform. Our goal for the end of this year is 25,000 customers. So
For the end of
we think we
2025.
end of 2025. Yeah.
25 and 25. Let's go, Andy.
25 and 25. Hey, I didn't even realize that. You got me in my little spiel now for my
There you
team.
go.
25 by 25.
There you go. I love it.
So, and we think we can do it. So it's the rate of people reaching out has increased, significantly over the last 6 months, especially. I think people are starting to finally realize, like, oh, this works. This isn't a crazy idea. A lot of people don't want to jump in to their getting their healthcare paid with some crazy idea. And so people are really realizing now that this works. And so we're excited to see that growth really accelerate.
What would you say to people, like myself, who's kind of on the fence? I've been paying outrageous amounts with a massively high deductible each month, and obviously, like you just said, it's a little intimidating to take the leap
Yeah.
because of just, I'm 55 years indoctrinated into this old system. And so as I'm getting older, it's like, okay, I'm still, knock on wood, I'm very, very healthy. Uh, but, I think it's intimate. Like, what would you say, like, as, the superstar CEO salesman to people to overcome those objections, which are like, well, what if something happens and I don't get funded? Or what if, all the what ifs that I think everybody listening probably has.
Yeah, it sounds like to me, from just the question you asked, as kind of an example, that it's based out of fear.
Of course.
There's
Yeah.
a fear that the bill won't get paid.
Yeah.
United Healthcare denies one out of every three, almost one out of every three claims.
Wow.
You've heard over and over and over again. I'm sure you have friends or family, or you've seen things on Twitter of all these people getting denied for their bills. You just heard about Remy getting denied by their bills.
Yeah.
So on average, health plans deny one out of every six. And United Healthcare is one out of every three. I gave you the stat earlier, 99.8% of our bills that have gotten submitted to the community have gotten fully funded. And so, for me, you're taking a much, much bigger risk. You're paying way more, and you're paying a much, much bigger risk to these health insurance plans than if you were to go with Crowd Health.
Yeah.
We've done dozens of cancer patients. We've done motorcycle accidents, automobile accidents, brain surgeries, heart surgeries, NICU babies. We had a guy accidentally shoot himself. That was $1 million bill. Um, so,
Oh my
we've
God.
had really big things. And what you're currently saying right now is the number one reason why we're not at $25,000, because people are like, what if, what if? What I say is like, just look at the data. I mean, health plans, we're sitting here as a business model right now because health plans are so absolutely terrible at getting bills paid. Where we've shown over 20,000 bills that that our crowd like viably gets bills paid, and they do it out of a sense of, I think it's a love your neighbor type of scenario where I'm doing it out of the goodness of my heart, is helping somebody else. We're doing it out of love. Your podcast here is love, right? As opposed to fear,
Yeah.
which is the way that health insurance plans treat you.
Yeah.
So, I mean, I have me, my wife, my two girls are on it. Almost all my family members are on it. Like I'm eating what I'm cooking. And I really do believe that it works way, way better than health insurance plans. So
Have you had any
bottom line is, I
people?
think it's more risky to be on health insurance than it is on crowd health.
I hear you. Have you had like a high turnover? Like once people become members, they're sticking with it, or have you had a bunch of people say, "Well, this isn't for me. I want to go back to my old way of being."
I mean, it is so. I mean, that's you have this set of assumptions building a company. I
Sure.
thought we were going to lose about 2.5% of people every month, and in fact, it's about half of that. So we lose a little over 1% a month, and 90% of those people are because they get another job that's like fully paying for their health care. And
Okay.
so,
So they don't
they're
have to pay
looking
for.
at like free versus $190. It's hard for me to beat free.
Yeah.
I think we're still better than free, but that's a harder sell. So, I mean, almost all of those people. And let me also say, like, if you go on trustpilot.com,
Uh-huh.
Trustpilot is a place where you have existing customers can leave reviews for you, and they actually verify that the reviews are from your existing customers. We've got 350 or something like that now reviews, and I think we're a 4.8 out of 5. And for a healthcare company, like, that's crazy. I think United is like 1.6 out of 5 or something like that. I mean, it's absolutely nuts that we, are that high. And it's because our customers are, so happy. Let me give you you're in Colorado, so I'll give you another Colorado example. And here's why customers love us. I think they were actually in Boulder. A family in Boulder was taking their kids out for a little hike, and so one of their kids was 6, a little boy, was hiking, climbing a rock, fell, and hit his face on a rock. And so he had to go to the ER and get stitches. And so our care advocate internally sent that little boy like a little climbing toy, so that he could climb in his living room, and with a little note that said something like, I hope this little accident doesn't keep him from a life of adventure, and so that was like 40 or $50 or something like that. But like, it was just our way of like loving our members really, really well. And so that little boy, and his mom cried, like she got it and
Of
cried
course.
because she was so, worried about, this little boy who's now doesn't want to go on climbing. So we're trying to get him back on the saddle. But it's little things like that you're just not going to get from your health insurance plan.
No.
And our little emblem is just a heart. And the reason why is
Mhm.
because when I asked our team, this is probably about 6 months ago now, maybe it's a little longer than that. I said, hey, what do we do better
Very good.
than anybody else? And the response I got was, we legitimately care. And it's just
Yeah.
like, do you want to go with a healthcare company that legitimately cares about you, or one that treats you like you are the product?
Right.
And that's the difference between us and a United Healthcare of the world.
Well, and I think you
So
nailed it, and the folks, your team and obviously customers, it's like, I believe the world, and this is why I obviously wanted to interview you and share the story about what you did with Remy, is like, I do think we have a crisis of caring right now, and it
yeah,
is based in fear, and it's based in not enoughness, and it's based in these old programs. And obviously, like I mentioned, I'm running an old matrix program from the old company, from, the insurance companies, from being a part of it for so long. So it does take time to shift gears, and obviously it takes time to become a Bitcoiner. It takes time to become, a world changer, when you want to believe in positive things, when you see so many negative things out there. And so
yeah, totally.
when you shine a spotlight and continue to keep shining spotlights on people who care and people who are doing good things, whether they're little, big, medium, small, it doesn't matter. It's like, the more that we keep emulating that and pushing that forward into the consciousness of our humans on earth, it's like, it's contagious. It really is contagious, like,
Yeah,
i've I've been wanting to meet you and interview you for a while, but then when I saw this, it was like, oh, okay, now this is perfect timing, because I've been, crowd health has been on my radar for a bit, but I haven't pulled the trigger, and this has been like, wow. So I think that's just so cool. And let me I'm just this is just great, Andy. I really appreciate what you guys are doing with people and bringing us together and making things more, like you said, like a community, instead of feeling like just this number, a case number somewhere. And just that little effort, to keep that young boy excited about climbing and being outdoors. I think that's like such a testament to what you guys are doing. And obviously we've got Remy here, just everybody. I pulled up her little GoFundMe page. So if you, it looks like her GoFundMe page is still, where is it? You can still donate to Remy, and she's, like you said, Andy, donating these funds to these two other children. And so if you feel like giving a little bit of extra Christmas cheer so that these wonderful little kids can have their arms and some functionality, you can go to GoFundMe.com. Everything will be in the show notes. And yeah, so where else can you, Andy? Where else can everybody find you?
yeah, we're active on most of the social media platforms. X is probably our most active, so you can find me there at Schoonover Andy, or Join Crowd Health. And so we'd love you to do that. We have a third one there too, called Crowd Health BTC. That's for our Crowd Health Bitcoiners, which is probably about a third of our group is Bitcoiners. And I think
What is that? Tell me
the
what that
reason,
is. Is that
yeah, and so
the
it's
thing with the fold group?
Fold, the thing with Fold. Yeah, yeah. And then we're starting to have Bitcoiners fund other Bitcoiners. So you're actually in a community of Bitcoiners that are funding each other's healthcare expenses. And I think that's important because, as we live, low time preference lives, the healthcare cost associated with maintaining that life will be lower than people who live a high time preference life. And I think that you should be benefiting from a low time preference lifestyle. So
Yeah.
those Bitcoiners are going to start funding each other, which I think the bills are actually going to be even lower than kind of the other group. So that's kind of cool there too. So Crowd Health BTC is our other uh, Twitter, or excuse me, X account.
It's another X account, okay. And then what
Yeah.
about, this came up, just a minute ago in my little brain, like, are there any regulatory things where, I mean, obviously we're getting a new administration here in the States, but do we have to have healthcare anymore? Is this Obamacare thing gone? Like, is it mandatory to have insurance? Is this not, is it okay to not have, be in the matrix? And
Yeah,
can you go
it's not
back
mandatory.
if you decide like, okay, I'm going to be one of those one percenters? Like, is it a problem for people to go re-enter if they wish?
No, I mean, I don't. There's no problems, and I think there's no federal mandate anymore to have health insurance, and so
Okay,
you don't have to have health insurance on the federal level. There's a couple state, or excuse me, 5 states: California, Massachusetts, New Jersey, Rhode Island, and Vermont. I think that do require you to have health insurance, or else you get penalized. We still have lots of members in those states because the penalty is oftentimes lower than the amount that you're saving joining
cool.
Crowd Health, and so we have a lot of people that are still members. I mean, I think that they will probably bifurcate the HSA with the health insurance plan. So I think some of our members, hopefully in the next year or two, will have access to HSAs, so to get the tax benefits of that.
Yeah,
I'd love to be able to put Bitcoin into the HSA. So, that would be super, super cool.
yeah.
And I think some of those things are going to happen. I'm having pretty high level conversations with people in DC around some of these things. And I think that these are things that they do value and I think will happen. So, I am bullish on healthcare here over the next at least couple of years.
I love it. And just one more question too, and thank you for all this time you're generously donating to us. And so, does this cover things like any kind of alternative healthcare if people are doing the functional medicine or acupuncture or,
Yeah.
any of those types of things?
Yeah, anything. If you go and have a health event or an illness, you can go and resolve that pretty much any way you want. If you want to go, do something super woo woo, then we'll have somebody else. We have a functional medicine doctor that we've contracted with to take a look at it and make sure it's not like super crazy.
Right.
We had a guy who wanted to do $100,000 surgery, and only one doctor on the entire planet would do it. And we took a look at that, and ultimately the functional doctor's like, this is not going to work. Funny enough, I talked to him 6 months after the procedure because he ended up paying for it himself, and guess what? It didn't work.
Oh,
And so it's like things like that. But ultimately, like you can go to pretty much whoever you want. If you have a back issue and you can go to the chiropractor. If you want to use acupuncture, you can do some of those things. And so,
what
yeah,
about
I mean,
dental?
yeah, dental, we give you one wellness visit per year that's fully eligible. So all the other health events have a $500. You pay the first 500,
Oh,
with the
right.
exception of a one wellness visit per year. And you can use that wellness visit for vision, dental, gynecology, primary care, pediatrics, annual labs, whatever you want to use that for. In essence, what we want to do is just make sure that people can get funded for these wellness visits that they have on a once per year basis. And so you can use that for dental. I want to do more dental with some of the bigger procedures. It's just the wild, wild west there. It's hard to. There's an article where one guy went to 50 different doctors and basically got 50 different um, prognosis for his dental issue. And it's just like, and they range from like it was like $300 to $30,000.
Yeah,
And
it's
I'm just like, I
insane.
can't even wrap my head around it. So I'm like, I want to do it. I'm not sure I want to jump into the chaos of all that, but
Yeah.
my
No,
heart is to do that because I know that people struggle with some of these big dental issues.
yeah, definitely, but you're so right. Like, I've had a couple different, obviously, if you're going out of the country too, if you're in Mexico or some other place, the dental care is so much cheaper and it's obviously good too if you're going to a good place. But yeah, I had 3 different prognoses varying from a couple $100 to $7,000 for teeth, and I'm just like, "What are you guys doing?"
Yeah,
It's a
it's
murky
crazy.
area. It's a gray area
It's
for
so
sure.
murky.
Um, well, awesome. Thank you so, so much, Andy. I really, really appreciate you. And I'm looking forward to, I'm going to check some more stuff out. It's the end of the year. And I'm like, well, maybe I'll do this instead
Oh,
of
come join us.
come join us. I
And
know,
a
and
bunch of other
I'll
Bitcoiners.
be on the Bitcoin crew for sure. Um,
Yeah,
yeah, that'll be really cool. That'll save me so much money too. Oh my gosh. Yeah, it's nuts. I mean, it's seriously, it's like you look and then the deductible on top of everything, is just nuts. And so,
it's crazy.
Yeah. Well, cool. Well, thanks so much. And I really, really appreciate your time. Everybody listening, go to joincrowdhealth.com and you can check out what Andy's up to. You can set appointments if you guys have questions with them down at the bottom and contact them and make sure you get all your questions answered. And, we'll take some leaps of faith here together and build this bright new orange future. Yay. And it's red today because it's 2 days before Christmas. All right, Andy, thanks so much. I hope you and your family have the best holiday ever. And we'll look
Yeah,
forward to talking to you. And if you do, if and when you get, obviously I'll be, I follow you and everything. If there are any updates with the HSA or stuff like regulatory stuff and you want to come back on and talk about it, let me know and I'll be happy to bring you back up.
would love that. Merry
Awesome.
Christmas to you.
Okay. Merry Christmas.